The 2026 Winter Olympics in Milan is bringing people together from all over the world. Competition is fierce. Flags wave and participants face off as they overcome challenges they could only imagine. Some of these challenges are so small that their power can be underestimated. On February 5th, the women's ice hockey game between Canada and Finland was postponed from 9:10 p.m. local time to February 12th at 2:30 p.m. because several members of Finland's team became sick with norovirus. Some members were quarantined as a precaution. The majority of the team was unable to practice, much less compete. The Switzerland women's hockey team was unable to participate in the opening ceremonies when one of their athletes tested positive for the virus. Globally, norovirus causes about 685 million cases of gastroenteritis each year. In the United States, norovirus is the leading cause of outbreaks from contaminated food. It comes on fast. Symptoms are unpleasant. Fatalities are low, but it will ruin your day. Well, it will ruin your several days. I'm Wanda Frazier. This is Your Body and You. Data for norovirus is a little bit confusing. Many people with norovirus don't seek medical care, so tracking them relies on estimates and wastewater surveillance testing. In populations, wastewater surveillance provides some guidance to estimate cases, define current strains, and level of spread. Norovirus tends to spread seasonally during colder months, so a lot of data will be structured to the season. In the United States, it tends to spread from late fall through the winter months and early spring, so November through April. Individual cases are not reportable to the CDC. The CDC does generate estimates and monitor norovirus genotype trends in children that have been seen in a clinic or hospital. Globally, NoroServe serves as a shared surveillance network for norovirus cases in children. In the United States, norovirus causes around 19 to 21 million cases of vomiting and diarrheal illness annually. 109,000 hospitalizations, 2.3 million outpatient visits, 450,000 ER visits, and around 900 deaths. Most of the ER visits are among children. Most of the deaths are among seniors. Outbreaks of norovirus are reportable to the CDC. Currently, 14 states participate in the CDC's Norostat norovirus outbreak reporting system. Annually, there are about 2,500 reported norovirus outbreaks in the United States. Outbreaks can occur in schools, cruise ships, healthcare facilities, and food service locations. This graph shows suspected or confirmed norovirus outbreaks in the Norostat participating states from 2012 to 2026. From the left shows August 1st of one year to the right, which is the end of July the following year. The dotted black line shows the minimum reported cases in that time frame. The solid black line shows the maximum reported cases. The blue area shows the range of the middle 50% of the data set, also called the interquartile range, IQR. The red line shows the current season starting in fall of 2025. Except for November, This season, we are within the interquartile range most of the time. We'll see how this progresses. EPIC research uses electronic health record data to compile weekly national data sets on infectious diseases. In this map, the darker the color, the more cases of norovirus. So Montana, Wyoming, Colorado, and Nebraska have seen the highest cases in the week ending January 17, 2026. Background and treatment relate, so I'm going to talk about these together. Norovirus refers to the genus of a group of viruses within the Calicidivae family that causes gastroenteritis, or inflammation of the stomach and intestines. There are currently 8 genogroups and 44 genotypes. In this image, groups in bright blue, light blue, and bright pink can affect humans. It was first called Norwalk agent in 1968 when the first outbreak occurred in an elementary school in Norwalk, Ohio. Some people refer to these as viral gastroenteritis or the cruise ship bug. It is a misnomer to call it the stomach flu, since norovirus is different than influenza and is not respiratory. It is transmitted through vomit or fecal matter via contact with contaminated objects, hosts, water, air, or food. This includes bivalve shellfish, such as uncooked oysters. These shellfish filter feed. Untreated human sewage or vomit can infest their environment. The FDA does send out alerts to the public with details and recommendations. State agencies will temporarily close contaminated shellfish beds until water testing shows the shellfish are safe to eat. A person is contagious from a couple of days before symptoms begin up to a couple of weeks after. So a host can spread norovirus before they know they are infected. Symptoms begin a few hours or a few days after exposure. Symptoms include nausea, vomiting, and diarrhea. Most people recover within a few days with extra hydration and rest. Seek medical help if you are unable to keep any liquids down. Severe dehydration generally sends people to the hospital. For infants, one warning sign for dehydration is crying with no actual tears. Most doctors diagnose norovirus via symptoms. Testing can be obtained via stool samples, but is not common unless institutions are identifying the specific strain of an outbreak. Long term, a patient can become reinfected with a different strain of norovirus. Norovirus adapts quickly, so any human immunity is temporary. Prevention. Norovirus, like the poliovirus, is difficult to kill. Structurally, it has a strong protein outer capsid. These viruses are called non-enveloped viruses. They can withstand freezing temperatures and heat up to 145 degrees Fahrenheit. Alcohol-based hand sanitizers don't work as well as the friction of hand washing. It can live on surfaces for several weeks. The best current prevention methods for norovirus are within your control. So wash your hands often, 20 seconds with soap and water. Here are CDC's fact sheets for food service workers. Wash laundry in hot water. Disinfect all hard surfaces. If you are sick, stay home. Don't prepare any food for at least 48 hours after symptoms stop. Currently, there are no approved vaccines to prevent norovirus. However, Some vaccines are in clinical trial stages, one from Moderna, one from Vaxart. The University of Texas Medical Branch received a grant from the NIH to study norovirus defense. Check if either of these studies are still recruiting participants. So stay diligent, talk with your healthcare team about any risks and ask for suggestions. Check on your people. If you are watching this from the comfort of your bathroom, I wish you a speedy recovery. Please like, subscribe, and share this video. Comment something useful because none of us have time for nonsense right now. I'm Wanda Frazier. This is Your Body and You.